everyone, welcome to Ophthalm Surgery. I'm going to discuss about soft contact lens fit assessment. In soft contact lens fit assessment, we need to see these 8 main factors. One is centration, coverage, movement, push-up, lag, age, comfort and modification. First one is centration. Centration is superimposition of center of cornea and center of lens. In optimal and stiff fit, it will be centered. In flat fit, it will be decentered. Second one is coverage. Ideally, 1 mm of symmetrical overlap will be present. It means the lens will extend 1 mm beyond the limbus in all positions. In optimal fit, it will be completely covered. In stiff fit, it will be decentered and poor recovery. In flat fit, overriding will be there. Third one is movement. Movements are very important in tear exchanging. It depends on lens type, design, material, lid factors and anterior anatomy of eye. We usually see the movements vertically. In optimal fit, you will see 0.3 to 0.6 mm movement. In stiff fit, less than 0.2 mm. In flat fit, more than 1 mm. Fourth one is push-up test. In this test, the lens will be pushed with the finger with the use of lower lid. Here we need to observe 2 things. One is pressure we are applying to push the lenses. In optimal fit, 50 to 60% pressure needed to push the lenses. In stiff or tight fit, we need more pressure to push the lenses, more than 70%. In flat or loose fit, only less pressure needed, less than 40%. And the second one is, after pushing the lenses, we need to note the recovery. In optimal and flat fit, it will be quick recovery. In stiff fit, it will be slow or nil recovery. And the fifth one is lag. Lag basically resistance of lens to move with the eye in all gazes from the primary gaze. We will ask the patient to look up and ask them maintain the position without blinking. Simultaneously note the centration of the lenses. In optimal fit, you will see 1.5 mm lag, and in stiff fit, little or no lag will be present. In flat fit, more than 2 mm will be there. And the sixth one is edge. In optimal fit, there will be no indentation. In stiff fit, indentation will be present. In flat fit, it will be flirting. And the seventh one is comfort. In optimal fit, comfort will be good. And stiff fit, initially it will be good. In flat fit, it will be poor. Eighth one is modification. In optimal fit, we don't need to do any modification. In stiff or flat fit, we can follow PAP-SAM rule. Here, to make it flat, add plus. To make it stiff, add minus. Means, if it is stiff fit, you can flatten the base curve. If it is flat fit, you can stiffen the base curve.
Click, clack.